Is just around the corner, and if you're planning to head out to the beach, be sure to protect your skin. May is Skin Cancer Awareness Month. In fact, skin cancer is the most common cancer in the U.S. according to the CDC. Joining us this morning with more on what you need to know is Dr. Susanna Grima, dermatologist from the Straub Medical Center. Good morning, doctor. How are you doing this morning?
I'm great. Thanks for having me.
Now, first off, what are some of the danger signs of skin cancer?
Well, there are three major types of skin cancer that most people talk about: basal cell, squamous cell, and melanoma, and they all tend to look a little different. Basal cells are the most common type, and they tend to look like pimple-like spots that are pearly or scar-like patches that continue to grow or just don't seem to heal. Squamous cells are the second most common type of skin cancer, and they tend to be scaly, rough patches or bumps that continue to grow, and they usually occur on chronically sun-exposed areas. And then melanomas are one that we talk about a lot because they tend to be riskier, especially when identified at a later stage. And they are the third most common type of skin cancer. And those usually look like moles. So if you're noticing any new moles or existing moles that are changing, those are usually danger signs. And those are the types of skin cancers that we talk about when we say A, B, C, D, E. The A stands for asymmetry. B is border irregularity. C is for color variegation, so multiple colors within. D is for diameter greater than a pencil tip eraser. And then E is for evolution. And that's one of the more sensitive signs of skin cancer, in particular melanoma. So if you're noticing any changes. And then one I always like to talk about with my patients is the ugly duckling sign. So if you have tons of moles or freckles, you're looking for the ugly duckling within it, and that's usually a sign of potential skin cancer.
So, doctor, how often should people be getting their skin checked?
It depends on your risk. So if you're out in the sun a lot, whether it be for recreation or for occupation, if you have a family history of skin cancer, personal history of skin cancer, if you're immunosuppressed, or if you've had lots of sunburns, in particular at a younger age, I usually recommend that patients are seen at least once or twice a year. If you're lower risk, then usually every couple of years.
Now, a lot of people in Hawaii like to stay active, whether it's hiking, biking, swimming, or going to the beach. What types of sunscreen should people be wearing?
So with sunscreen, it's not one size fits all. It depends on the patient, just how much skin is exposed and what they're doing outside. But normally I tend to recommend a mineral-based sunscreen, so one with zinc oxide or titanium dioxide. And what you're looking for is SPF 30 or greater, and for it to be broad spectrum, because then you know it's covering UVA and UVB rays, which can both cause skin cancer. So I always suggest, the best sunscreen to wear is the one that you're going to wear. So for all patients, mineral sunscreens aren't the best, and they may require a mix of mineral and chemical components, just depending. So I also recommend using UPF protective clothing, which is UV protective factor. And what you're looking for there is a protective factor of 50.
And doctor, anything else you want to add before we leave?
Yeah, so a lot of people think that skin cancer only occurs in the fair population or the fair-skinned population, but that's not true. We do see skin cancers in people that tan easily, so it's really important that you do have a baseline skin check and then have your risk assessed.
All right, there you have it, Dr. Grima. Thank you so much for your time and some great tips, because a lot of people in Hawaii love to stay active and be outside. So thank you very much and have a great day.
Yep, you too. Bye-bye.